The state government has been accused of breaking a promise by scaling back care for seriously ill babies at the Flinders Medical Centre. While the plans to divert the most serious patients elsewhere, the government is moving ahead with a $17 million upgrade of the hospital's neonatal unit.
Playing politics over tiny lives, the state government is pushing ahead with a pre-election promise to upgrade Flinders' neonatal unit. But under its recently announced health reforms, the most seriously ill babies would be transferred to the women's and children's.
We're talking about a very small number of the very tiniest, most frail babies, making sure that they get the best possible care.
The opposition says it's a broken promise.
The government has got to explain how is it going to be better for those children to not be able to get intensive care at this site and be forced to be put in an ambulance and transferred.
Mother of two, Penny Bennett, is campaigning to maintain current services. Her children both spent weeks in Flinders' neonatal unit.
It's also the toll that it's going to take on families that are already struggling emotionally and financially and physically.
We think that the opposition's jumping the gun in terms of saying there's no basis for it. We think the government would be unwise to act.
The Health Minister confirmed there wouldn't be any changes until the Women's and Children's Hospital is co-located with the new Royal Adelaide, part of a 10-year plan which so far has no funding. The opposition is also warning South Australians they only have 11 days left to have their say on the government's major overhaul of health. That includes the controversial plan to close the repatriation hospital and downgrade emergency capacity. Lauren Barker, 9 News.